Mhm. Okay. Professor Assam Tamara is the Vice Dean of Al-Azhar University Faculty of Medicine. And now we'll start. Now we are ready to start our opening ceremony at time, and I will leave the mic to Professor Walid Khareba, the masterpiece and the master key of the conference. Mic is yours, Walid.
بسم الله الرحمن الرحيم والصلاة والسلام على أشرف المرسلين. بنرحب بحضراتكم جميعا وبنبدأ حفل الافتتاح بالقرآن الكريم. اتفضل.
بسم الله الرحمن الرحيم. اقرأ باسم ربك الذي خلق، خلق الإنسان من علق. اقرأ وربك الأكرم الذي علم بالقلم، علم الإنسان ما لم يعلم. كلا إن الإنسان ليطغى أن رآه استغنى، إن إلى ربك الرجعى. أرأيت الذي ينهى عبدا إذا صلى، أرأيت إن كان على الهدى أو أمر بالتقوى، أرأيت إن كذب وتولى. ألم يعلم بأن الله يرى، كلا لئن لم ينته لنسفعا بالناصية، ناصية كاذبة خاطئة. فليدع ناديه سندع الزبانية، كلا لا تطعه واسجد واقترب.
صدق الله العظيم. السلام الجمهوري لجمهورية مصر العربية. باسم بورد المؤتمر بنرحب بحضراتكم جميعا وشاكرين تعبكم ومجهودكم، وان انتم حريصين ان انتم تبقوا
بسم
موجودين
الله
نتعلم
الرحمن
من خبراتكم
الرحيم.
ومن علمكم.
اقرأ باسم ربك الذي خلق، خلق الإنسان من علق. اقرأ وربك الأكرم الذي علم بالقلم علم الإنسان ما لم يعلم كلا إن الإنسان ليطغى أن رآه استغنى إن إلى ربك الرجعى أرأيت الذي ينهى عبدا إذا صلى أرأيت إن كان على الهدى أو أمر بالتقوى أرأيت إن كذب وتولى ألم يعلم بأن الله يرى كلا لئن لم ينته لنسفعا بالناصية ناصية كاذبة خاطئة فليدع ناديه سندع الزبانية كلا لا تطعه واسجد واقترب.
of Faculty of Medicine, Azhar University, Damietta, Professor Dr. Ibrahim Sayyad, Vice Dean of Faculty of Medicine, Azhar University, Damietta, Professor Dr. Ayman Fakhri, President of Egyptian Venous Forum, Professor Dr. Walid Khariba, Professor of Vascular Surgery, our professors, colleagues, and esteemed guests. On behalf of the conference member, I would like to welcome you all to the Flip Egypt Summit 3, which represents the collaboration between the 12th International Conference of Egyptian Venous Forum and the 10th International Conference of Vascular Surgery Department, Faculty of Medicine, Azhar University, Damietta. We are especially delighted to extend a warm welcome to our esteemed guest joining us from outside the Arab Republic of Egypt, whether attending in person or participating virtually. Your presence and engagement enrich this conference and greatly contribute to the exchange of scientific expertise among the various international medical schools. We also extend our deepest appreciation to all professors, colleagues, speakers, attendees, and researchers who are dedicated to keep us with the latest advancement in the field of vascular surgery. This conference is being held at the Hilton Hotel in Port Fouad, a region in Arab Republic of Egypt that is considered part of the Asian continent. This unique geographical feature grants Port Said governorate an Afro-Asian identity. This conference serves a platform to discuss the scientific and technological advancement in vascular surgery in general, with particular focus on the vascular surgery in pediatric. It brings together an elite group of distinguished experts in this highly specialized field to share their knowledge and experience. This event underscores the importance of the scientific research and technological advancement in improving diagnostic and treatment methods, ultimately enhancing the quality of medical care provided to the patient. We value the effort of all speakers, attendees, and researchers who continuously strive to introduce a latest innovation in this vital discipline. Many workshops were held on the sideline of conferences through the year, aimed to teach the basic principle of vascular and endovascular surgery, managing the wound and infection in diabetic foot patient, and utilizing the artificial intelligence in the field of vascular surgery. We hope this conference will serve a fruitful platform for discussion and knowledge exchange, as well as opportunity to strengthen collaboration among the vascular surgery specialists for the benefit of patient and the medical community as a whole. At this moment, we would also like to express our sincere gratitude and appreciation to our sponsoring companies, whose generous support has been instrumental in the success of the conference. Furthermore, we extend our deepest thanks to the organizing company, which has put in great effort in preparation and coordination to ensure that this event is presented in the most outstanding manner befitting its scientific significance. Once again, We warmly welcome you all and wish you a successful conference filled with valuable insight and innovation. المتولي رجب, Professor and Head of Vascular Surgery, Faculty of Medicine, Azhar University, Damietta. May peace, mercy, and the blessing of Allah be upon you.
شكرا للاستاذ الدكتور متولي رجب. والكلمه الان للاستاذ الدكتور عصام طمان وكيل الكليه للدراسات العليا والبحوث. فليتفضل.
بسم الله الرحمن الرحيم. الحمد لله رب العالمين، والصلاة والسلام على المبعوث رحمة للعالمين سيدنا محمد وعلى آله وصحبه وسلم أجمعين. السادة المنصة الكرام، السادة الحضور الكريم، أساتذتي وزملائي الأعزاء، برحب بحضراتكم جميعا في المؤتمر ال 12 وليد. طبعا ما شاء الله يعني الاسم التاريخ قديم، يعني المؤتمر ال 12 لاسم جراحة الأوعية كلية طب الأزهر بدمياط الجديد. الحقيقة اسم جراحة الأوعية بكلية طب الأزهر بدمياط وما يقدمه من خدمات برئاسة أخي العزيز الأستاذ الدكتور متولي رجب والسادة أعضاء التدريس بالاسم دكتور وليد، دكتور خالد، ودكتور محمود، دكتور سيد، ودكتور عمرو. يعني لهم الاسم وما يقوم به من مجهود في علاج المرضى، وخاصة بعد افتتاح وحدة القسطرة القلبية، القسطرة الخاصة بقسم الأوعية الدموية، وما يقدمه من خدمات علاجية للمرضى، وما يقدمه من خدمات تعليمية وبحثية لطلاب الدراسات العليا خاصة. لا الحقيقة حاجة بنفتخر بها كلنا في كلية طب الأزهر بدمياط، وإن شاء الله بنتمنى إن ما بعد افتتاح مستشفى الجراحات التخصصية القائم حاليا إنشاؤه بمستشفى الأزهر بدمياط، نتمنى منهم المزيد في مع إنشاء المبنى ده، وهم إن شاء الله ليهم جزء فيه بإذن الله. لمن لا يعلم ان مستشفى الازهر بدمياط هي قائمه على مراكز متخصصه. يعني احنا شغالين حاليا في المبنى القديم ومبنى ملحق معه بطاقه حوالي 470 سرير، والمستشفى قائمه على 5 مراكز متخصصه في الفتره القادمه ان شاء الله، منهم القائم حاليا انشائيا يعني في خلال اقل سنه تقريبا قسم مستشفى الامومه والطفوله ومستشفى الجراحات التخصصيه واحد، ولسه في 3 مراكز. ان شاء الله احنا التارجت بتاعنا احنا نوصل ان المستشفى في نهايه الانشاءات بتاعتها باذن الله يعني هتوصل لحوالي 2000 سرير. يعني ان شاء الله مستشفى الازهر هي بالفعل هي علامه مميزه لطب الازهر بدمياط وجامعه الازهر. نتمنى بالفعل انها تكون بالفعل اضافه لجامعه الازهر وجمهوريه مصر العربيه ان شاء الله بالخدمات اللي بتقوم بها المستشفى. I welcome our dear guests, wish you a successful conference and happy stay in Port Said. في الطبيعة كل الشكر والتقدير للقائمين على هذا العمل. أتمنى لهم اسم زي ما بقول كده اسم جراحة الأوعية الدموية بالكلية ومن الأقسام المنتظمة في المؤتمر بتاعنا. نتمنى لهم كل التوفيق والسداد. مرة تانية برحب بحضراتكم جميعا. السلام عليكم ورحمة الله وبركاته.
دكتور عصام. والكلمه الان مع الاستاذ الدكتور ابراهيم الصياد وكيل الكليه لشؤون التعليم والطلاب.
السلام عليكم ورحمة الله وبركاته. الحقيقة عشان ما أطولش عليكم، بدعوة كريمة من الأخ العزيز الأستاذ دكتور متولي رجب بحضور هذا المؤتمر. بتذكر دائما في مؤتمرات جراحة الأوعية الدموية الأستاذ الدكتور رؤوف حسن يوسف، وهو علامة مضيئة في جراحات الأوعية الدموية إن لم يكن على مستوى مصر فعلى مستوى العالم العربي. تولى رئاسة قسم جراحة الأوعية الدموية منذ 25 عاما في دمياط، وبعده تولى الأستاذ الدكتور أيمن محي الدين، ثم قاد القاطرة الأستاذ الدكتور متولي رجب ومعه فريق من الأطباء المحترمين والأعزاء والإخوة الأفاضل. أتمنى مش هطول عليكم، لكن برحب بكل السادة الضيوف سواء من مصر أو من خارجها، وأتمنى لكم أن تخرجوا جميعا بتوصيات وبنتائج مبهرة لهذا المؤتمر، وأشكركم جزيلا. ثانك يو، والسلام عليكم ورحمة الله وبركاته.
شكرا دكتور ابراهيم. والكلمه الان مع الاستاذ الدكتور ايمن فخري رئيس المؤتمر، فليتفضل.
Thank you, Dr. Walid. Professor Dr. Hassan Turab, the Vice President of Al-Azhar University Boys, New Damiata. Professor Dr. Samir Al-Wakil, the Vice President of Al-Azhar University, New Damiata Girls. Professor Dr. Mutali Ragab. Ladies and gentlemen, dear friends, dear colleagues, and dear fellows in Egypt and along the universe. I'm honored today to extend my gratefulness for you all for attendance our conference, the third Flebo Egypt, this great evidence based conference, combination between the 10th International Congress of Vascular Surgery Department of Al-Azhar University, New Damiata, and 12th International Congress of Egyptian Venous Forum. And I'd like to extend the words of Horace, and I want to extend his thankfulness for you all. In his words, Horace wanted to say to you in the ancient Egyptian language, Ika dos nato or. Ika dos nato or. What means you are in my eyes. Please remember Horace I and remember what he wants to say to you. Horus is the symbol of our society, and we try to take his words to tell you are all in our eyes. I wish you enjoy our sessions and enjoy the video. We have made a dedicated video to celebrate one of the greatest Arabic scientists, Ibn Sina. We have a small video. I hope you will like it about this gentleman. Also, I'd like to inform you, please be sure that you have a digital copy of our book. This book, which includes the name of the theme of the conference, Vascular Disorders in Children. It is written by 12 international speakers. Please be sure you have a digital copy in your bag. And who wants to get a hard copy, please let us know. Thank you. And I hope to see you again next year in the Flebo Egypt 4. Please mark your calendar for May 1st. Thank you, and I wish you all a very good day. And now I'm honored to introduce the opening lecture that will be presented by Professor Lowell Kabnick. Lowell Kabnick is a giant of phlebology, and he's the ex-president of American Venous Forum, and now he is the chancellor of the Venous and Lymphatic University. Please the play video, and Lowell is with us online. Please play.
I'm sorry that I could not be with you at this meeting. In addition, I would like to thank Eamon Fakhri and the organizing committee for the honor and privilege to present to this prestigious audience on gold standard and new superficial venous devices undergoing trials. Could they be game changers? These are my disclosures. What is important to you regarding ablation? Exposure rate, patient acceptability, cost, portability, cost effectiveness, profit, reintervention rate, complication rate. We know that one size does not fit all, nor is one thermal or non-thermal device perfect for all cases. What is the definition of gold standard? It denotes the best tool available at the time to compare different measures. Who is in control of the gold standard, or who is in control of what devices we use? I would hope it would be the doctors. However, we know better. We may have influence, but in the US, it is controlled by the insurance industry and the government. One of the first randomized controlled trials comparing different ablative devices included endothermal with superior to foam and surgery. So let's look at the literature. In 2017, Enrico Asher and Anil Hingorani wrote clinical correlations of success in acute thrombotic complications of lower extremity endovenous thermal ablation. And they found that there were no differences in efficacy between RFA and laser. In the Journal of Angiology, Professor Alan Davies concluded that thermal treatment with RFA or endovenous laser ablation is the mainstay of varicose vein treatment. Both RFA and laser appear to have similar efficacies. Looking at laser, RFA, and foam sclerotherapy, Professor Bittenden reported in the New England Journal of Medicine in 2019, looking at 5-year outcomes, that disease-specific quality of life 5 years after treatment was better after laser ablation or surgery than after foam sclerotherapy. The majority of the probabilistic cost-effectiveness model iterations favored laser ablation, and a willingness to pay ratio of approximately 20,000 pounds or $28,000 per quality. Now let's look at non-thermal, non-tumescent treatments. Does size matter? It appears to, as the non-thermal limitation by the FDA trials for less than 12 millimeters. The new European Society for Vascular Surgery 2022 guidelines support thermal ablation for great saphenous vein. Treatment is the gold standard. As you can see, the first tier is thermal ablation. The second tier is surgery and glue. And the third tier is mechanical, chemical, catheter-directed foam and ultrasound-guided foam sclerotherapy. Finally, for SSV treatment, thermal ablation is the first choice treatment modality. At Charing Cross in April of 2024, Professor Manoj Goel and Dr. Kathleen Gibson announced the results of the VenaSeal Spectrum study. VenaSeal performed similarly to both surgical stripping and endothermal ablation in terms of elimination of truncal reflux. 6-month effectiveness data showed that VenaSeal was non-inferior to surgical stripping with similar anatomical closure rates. The equivalent measure was not tested between VenaSeal and endothermal ablation. At 30 days, participation in both the glue closure and stripping arms were similarly satisfied post-procedurally. If we look at an independent market analysis, the blue arrow and the red star, you can see the following. Regardless of the percentages of thermal ablation versus non-thermal ablation, thermal ablation will continue to be the go-to devices for truncal ablation. So let me be the fortune teller. Is thermal ablation the gold standard? Let me look into my crystal ball. My crystal ball says yes, 2019 to 2027. Now let's look at the Ouija board. Is thermal ablation the gold standard? Yes. Ladies and gentlemen, in conclusion, there appears to be clinical equipoise amongst the ablation procedures. No perfect device at present for all superficial venous disease. Cost of materials versus reimbursement, insurance approval, financial incentive, and physician preference is multifocal. Now let's look at some of the new devices undergoing trials. Let us start with percutaneous clamping devices, the secure clamp and the vein closure device. The secure device is a percutaneous device which delivers a clamp through an 18-gauge needle. As you can see, there's a broad range of applications. The first in human safety study with a secure clamp, the average procedure time was less than 10 minutes. High safety profile with follow-up of 12 months, improved quality of life outcomes. There was a need for change of the delivery device to make it single-handed. The trauma application looks exciting in that the secure clamp temporary occluder, known as secure TO, may help to prevent loss of limb, and more importantly, this is an area where a non-compressible junctional hemorrhage has a huge role. In the field and under ultrasound guidance, a temporary occluder is delivered. Since it is flexible, it can be taped to the skin. The occluder can be released to establish blood flow as needed. In addition, the clamp may be removed non-surgically. The next device is called the VCD, or the vein closure device. As you can see, there are two bioabsorbable clips that can pass through a 17-gauge needle and takes approximately 6 to 12 months for implant degradation. The target vein diameter is up to 11 millimeters. So let's see how it works and watch the video. It's a very simple procedure. The VCD has many uses, as you can see. Shiva, perforator, veins, truncal stumps, junctional ligation and foam, and truncal recanalization. The first in human trial had 24 patients which were successfully treated. Vein diameters were treated up to 16 millimeters, and all great saphenous veins were occluded. There were no major adverse events. On the screen left, it demonstrates an occluded perforator. Let's switch topics and move to mechanical chemical ablation and MOCA. Envira has two different devices under development, one mechanical only, two mechanical chemical. The helical coil macro and micro abrasive surfaces cause cellular disruption of the vein wall. Envira works through three mechanisms. The helical coil abrasive surface causes cellular disruption of the vein wall. The acute response triggers venous spasm, reducing blood flow, and starts the biological healing response necessary for vein closure. The chronic response turns this attached intraluminal thrombostasis into a fibrotic cord, which then fills the lumen. In the pilot study, 13 patients were treated with a significant quality of life AC score at 6 months. 53% showed an ultrasound, a significant diameter reduction, with one patient at a complete closure. There were no device-related adverse events. It was a single injection of local anesthesia. Moving on to mechanical chemical ablation, you can see the ablative mechanism in the video, followed by the chemical portion. The pilot study for this MOCA device included 10 patients using 2% polydocanol foam. 100% of the saphenous veins were free of truncal reflux and closed at 6 months, quality of life, and patient-reported outcomes measured improved. Although this device, Sclerosafe, has recently been approved by the FDA and has commercialized into the USA, is important to show. The procedure is pretty standard using modified cylinder technique that passes Sclerosafe catheter, which has 2 lumens connected to a double syringe with one of the syringes containing foam sclerosant and the other empty, which is the aspirating syringe, which allows mechanical aspiration of blood and some foam and potentially injury to the vein wall. Let's look at the video. As you can see, the catheter is delivered, and then the double syringe technique will deliver foam, and in the other syringe, aspirate blood as well. Looking at the registry study in the Red Cross Hospital in Frankfurt, 135 patients with follow-up as long as 1 year occurred. Results of 3 to 4 months, 95%, and a 12-month follow-up, a 90% closure rate. Moving on to the next MoCA device, Wavella, which is a segmental MoCA. The treatment length is 7 centimeters coupled with a drug infusion port. As you can see from the specs, it's quite similar to Claravane, with segmental ablation similar to the legacy 7-centimeter closure device, with a vessel diameter treatment for 4 to 12 millimeters. Moving on to a different mechanism of action, however, not completely, as one of the high intensity frequency ultrasound uses thermal, and the other one uses cavitation. The operator positions the treatment head on the patient's leg. The fine-tuning of the positioning is controlled by the system. Echo therapy can be safely applied 2 millimeters from the saprophymal junction, literally eliminating the risk of stump formation after treatment. The beam can follow virtually any path, even tortuous veins, regardless whether big or small. Once the target path has been treated, the head can be easily moved to the next segment. Very difficult to access veins, such as perforators, can also be treated, even in the presence of an open ulcer. The trial will be completed in June. As you can see, this is an FDA trial. In 2024, Paolo Cassini and group published HIFU in treating the great saphenous vein incontinence, perioperative and 1-year outcomes. They concluded that out of 188 limbs, the great saphenous treated segment shrinkage closure rate at 1 week was 93.3%. At 12 months, was 98.3%. However, they also looked at closure and no reflux. As you can see, the closure rate at 1 year was 72%, and without reflux, 19.1%, and a total failure in their definition of 8.5%. Switching over to HIFU cavitation, this is a new concept idea for vein ablation. HIFU cavitation works by exciting the small air bubbles naturally present in the veins. These bubbles oscillate until they collapse, effectively scouring and treating the inner walls of the vein. The procedure seems to be easy, with applying the probe to the patient with automatic vein identification based on computer vision and AI safety. This is followed by treating the vein. Let's switch to a different device called a Salutio catheter. This device could be a game changer for thermal ablation. As you can see, the catheter can carry a laser fiber as well as a radiofrequency catheter. Local anesthesia is directed from the needle, which exits the vein from inside out and fills the saphenous compartment. Now let's look at animation. As you can see, tumescent anesthesia is delivered from inside out as opposed to percutaneous, leaving the ablative device in place as the catheter is withdrawn. In the first in-human study, there were 9 consecutive patients. The mean pain score during tumescent was 0.8 out of a 10 scale. There was no serious adverse events. The primary investigator reported that it was safe and easy to use. Thank you again to Professor Fakhri and the organizing committee for the privilege. If you should have any questions that are not answered, please use the QR code, which are my contacts. Thank you.
Thank you, Leol. It's a great lecture as usual, and thank you for keeping with us online. Now I will ask for question or comments from the floor. The panel have questions? Okay. Dear friends, you have a question, comment for Professor Lowell Kabnick? Yes, please. Dr. Omar?
Thank you very much, Loyal, for a fascinating lecture about all the new technology. Let me ask you, what do you think the technologies that will be with us for the next 10 years? Do you think the HIFU, the mechanochemical, which one do you think have the future? Because I have a little bit of a guess, but I would like to know your opinion. Thank you very much.
I wish I had my crystal ball, but as we go forward, the beauty I don't think we've seen yet. We're close with HIFU, and that would be able to have no damage. It would be just simple to hold a box over the vein and close it like HIFU. But for now, we look at the first generation, second generation, and maybe even the third generation that is really kind of slow. But I think over time it'll speed up. So I am in line with a non-penetrator type of device that will work through AI, and it can be operator dependent to a point, but I think it'll be able to be controlled by an assistant of ours through artificial intelligence. So I don't think we're there yet. If we look at what we have now, I still believe that thermal ablation will be the gold standard and for the next couple of years, but we're really rapidly moving toward non-thermal. So I would bet it'll be a non-thermal technique in 10 years.
Thank you, Lowell. It is a very good answer. My question, do you think that tumescent anesthesia, is there's a place to vanish this technique?
I didn't hear you quite well, Damon.
I ask you about the tumescent anesthesia and multiple punctures. Do you think in the future, we may sacrifice this technique?
Well, I am looking forward to the Salutio catheter, which essentially delivers tumescent anesthesia from inside the vein out, and therefore you don't have any punctures through the skin, and it's obviously less painful in the study. So that could be a game changer for thermal, making it quite equivalent then to non-tumescent type of procedures that are out there now, like the MOCA procedures, with better efficacy.
Great, this is good news. Any question, dear Franz? Thank you, guys. Thank you, Lowell. I appreciate your always keeping with us. I appreciate your support and your guidance. Thank you, Lowell, and see you soon in Egypt. Have a good day.
Thank you. It was a pleasure being here, and thank you for the invitation. In regards to all my Egyptian colleagues.
بشكر الدكتور عصام طمان على تشريفنا، الدكتور بيوم الصياد، أشكر تشير بيرسون فور بين من ساينتست. شرفتنا.